Hello, welcome to the pharmacy. How may I help you today?
Hi, I'm here to pick up my cholesterol medicine. My name's Sally Shaw.
Sure thing, let me take a look for you. Unfortunately, it looks like we ran into an issue when processing your prescription and we won't be able to get you your medication today.
What do you mean there's an issue? I've been on this medicine for months now. I only have one pill left at my house.
I hear your frustration, but it looks like your insurance is requiring a prior authorization for this medication.
Prior authorization, I don't even know what that means. Can you explain that to me? I need my medicine for tomorrow.
Hello everyone, this is Zoe Wang with the Pennsylvania Healthcare Benefit Solutions Program, and welcome to our podcast titled, The Impact of Prior Authorization on Accessing Healthcare in America. We will examine the concept of prior authorization, how it works, how it's used by insurance companies to limit a patient's access to healthcare services and prescription medications, and how patients and their healthcare providers can successfully navigate through the prior authorization process to obtain their needed care. So, let's get started.
The focal point of this presentation is understanding prior authorizations in healthcare. My name is Ranima Banerjee, and I'm one of your narrators.
My name is Cassidy Colano, and I am one of your other narrators.
We are first-year pharmacy students at the University of Pittsburgh speaking on behalf of the Pennsylvania Healthcare Benefit Solutions Program. So what is a prior authorization? It's a process in which healthcare providers must obtain permission to provide benefits and services from a patient's health insurance before proceeding with a specific treatment, medication, or service. It ensures that medication is necessary and meets coverage eligibility criteria from the patient's plan. The primary goal of prior authorizations is for health insurance companies to confirm that the given treatment is aligned with company guidelines and that it is medically necessary, safe, and cost-effective. Now we will take a look at some purposes of prior authorizations. Insurance companies require prior authorization for medical services, procedures, items, or medication to make sure that it is necessary for your care and that a provider or pharmacist is not prescribing additional unnecessary treatment. Prior authorization isn't required for emergency medical situations when a doctor and a pharmacist request prior authorization, but prior authorization is used to show that the service is medically necessary. And finally, some benefits of prior authorizations include management of prescription drug spending, clinically appropriate drug selection and utilization, especially with more expensive medications that are only sold for a brand name, promotion of safe drug use, and support drug formularies and rebate programs. Now let's dive into how labs are ordered and the intricacies of the prior authorization process. So first, a healthcare provider determines that a patient needs a specific procedure, test, medication, or device. The physician orders a lab test or paper rec or an e-order and enters it into the system. It's on the provider to then check a health plan's policy rules or formulary to determine if prior authorization is required for a prescribed course of treatment. If it is required, the provider will need to formally submit a prior authorization request form and sign it to show that the information supporting the medically necessity claim is true and accurate. The provider staff will often start by manually reviewing the prior authorization rules for the specific insurance plan associated with the patient. Benefits verification and eligibility criteria of the patient and their plan are obtained via the payer portal, which allows healthcare organizations to pull prior authorizations and check the status of referrals. Next, they check the prior authorization requirements. All health plans are pretty complex and are subject to change, so it's imperative to check requirements since payer rules aren't standardized, and contact the health plan for prior authorization form, which is plan specific, if a prior authorization is needed. A prior authorization request form is then submitted via fax, portal, or phone call. All necessary medical documents for the treatment, medication, or service are submitted as well. The responsibility falls on the provider to continue to follow up with the insurance company until there is a resolution of the prior authorization request, an approval, redirection, or denial. This part of the process is unstructured and often improvised. Finally, if the prior authorization is approved, the claim is then billed to the patient. The lab is notified of the patient's financial responsibility.
Let's look at the views of prior authorization from physicians across the country. In 2023, the American Medical Association conducted a survey on how prior authorizations impacted physicians and their ability to properly care for their patients. When asked, how often do treatments requiring prior authorizations delay access to necessary care, over 50% of physicians reported always or often. While physicians could already be treating their patients, they have to sit back and wait for the prior authorizations to be approved before starting to treat the patient. Physicians are seeing firsthand the negative, dangerous impact of prior authorizations. 93% of physicians report they felt that prior authorizations had a negative impact, and only 1% of physicians said that prior authorization has a positive impact. The ratio is unparalleled. The impact has led to 1 in 4 physicians reporting that prior authorization has led to serious adverse event for their patient. Not only can prior authorizations impact timing and maybe even quality of care, it can also add burden and stress to the physician. The physician may have to go to extreme lengths to get the prior authorization approved in order to be able to administer what may be a critical treatment. Physicians and other healthcare professionals can spend up to 12 hours a week completing and fighting for prior authorization approvals. Worst of all, if a prior authorization is denied, many physicians may not be able to work to appeal due to lack of resources and staff. Not having enough time to wait again due to the critical state of the patient, or feeling as they will just be denied again because most of the appeals do just get denied again and again. In addition to these negative impacts on physicians and their patients, prior authorizations can also increase utilization of health resources that may not be needed. Almost 40% of physicians report that oftentimes prior authorizations cause increased utilizations and therefore increase the cost of healthcare resources for both hospital healthcare setting as well for the patient. Some of the common reasons for increased utilization of healthcare resources include ineffective initial treatment, additional office visits, and needing immediate care. If a patient were to be denied a treatment, their condition may worsen, and then they may need immediate care such as an ER visit or hospitalization, which can increase the need for healthcare resources. When asked how often a prior authorization denial would lead to the patient paying out of pocket, over 50% of physicians reported that this would happen sometimes, and 20% reported that it happens often. Treatment's already expensive as is, having to pay out of pocket would only deplete their pockets more. In addition, 53% of patients report that the denials of prior authorizations impact their job performance. Employees may also have reduced productivity if they have missed work for rescheduled appointments. Sometimes some patients may want to pay out of pocket rather than go through the stress of prior authorization related delays in their care, presenting a severe economic burden on patients. Last but not least, we will be looking at the treatment abandonment. Some patients may choose to abandon care or treatment if a prior authorization is denied. At least 78% of physicians report that a prior authorization leads to some sort of treatment abandonment from the patients. This often leads to untreated diseases and conditions, worsening adverse effects, or needing hospitalization. All of these statistics from physicians only begin to describe the detrimental interference of prior authorizations on patient care. While on paper, prior authorizations are meant to prevent physicians from giving unnecessary services that may be costly, it is clear that prior authorizations have done more harm than they do good.
So what is the role of pharmacists? Pharmacists work at the counter, assisting patients and collaborating with physicians. They advocate for patients, can explain the complexities of prior authorizations, and with significant delays in approval, they help patients by providing alternate treatments such as the generic version of a medication/treatment or formulary-covered alternatives. Specialty pharmacists on the payer side review PA requests, ensure accurate documentation, and obtain missing clinical information for approval and denial decisions. Pharmacists are often working with payers, pharmacy benefit managers, and pharmaceutical companies where they determine factors such as drug pricing and reimbursement techniques. There are also programs like the Prior Authorization Certified Specialist certification offered by the National Board of Prior Authorization Specialists that provide pharmacist training to oversee the prior authorization process, allowing for a smoother process with greater payer approval. Pharmacists often view prior authorizations as a significant administrative burden. The process requires pharmacists to invest considerable time in coordinating with prescribers and insurance companies to obtain necessary approvals, which can delay medication dispensing. And it will also reduce the time available for direct patient interactions due to the delay of the prior authorizations. This administrative load connects to the professional burnout and diminishes job satisfaction among pharmacists due to the amount of pressure prior authorizations that it provides the pharmacist. According to a 2020 survey conducted by the American Medical Association, prior authorizations issued contribute to a 94% of care delays in pharmacies and in the clinical settings. So we can see that the issues that arise from prior authorizations not only impact patients in the hospital and provider setting, but also with pharmacists as well. A United States Senate report conducted in May 2023 closely examined Medicare Advantage insurers and the use of prior authorization to deny necessary services for older adults. The United States Senate Permanent Subcommittee on Investigations looked specifically into United Healthcare, Humana, and CVS Health, which are the three largest Medicare Advantage insurers. The results were quite shocking. From 2019 to 2022, these three companies had extremely high denial rates for post-acute care services compared to other types of care. Post-acute care can be described as the series of services provided to an individual whose conditions had stabilized following hospitalization in order to facilitate their return back to the community. This can include medical care, nursing care, rehabilitation, and residential care. United Healthcare's denial rate for post-acute care increased from 10.9% in 2020 to 22.7% in 2022. While CVS's denial rate may have remained steady, the number of prior authorizations for post-acute care rose by nearly 57.5% from 2019 to 2022. Humana increased their denials for long-term acute care by 54% between 2020 and 2022. In 2022 alone, there were more than 46 million prior authorization requests. This really puts into perspective the growing impact prior authorizations are having on the community. These are some types of healthcare services that require prior authorization. Hospital admission and surgery, which some common procedures include MRI, CT scans, and PET scans that may need prior approval due to high cost. Specialty medications, which often high-cost drugs, including certain biologics and injectables, often require prior authorizations to confirm appropriate use. Outpatient department services, which contain services like toxin injections, rhinoplasty, etc., which may require a PA. Rehab therapies, which are like physical and occupational and speech therapy, which may require prior authorization. Mental health and substance abuse treatments, in which inpatient psychiatric care and certain outpatient services may need a prior approval. So prior authorizations has only gotten more and more strict, and more denials have occurred within the last 5 years. Unfortunately, health outcomes based on the prior authorizations look subpar.
Shown here are the top 7 most common reasons you can come in contact with a prior authorization. I will be breaking down each of these topics individually, starting with the lack of medical necessity. A lack of medical necessity denial occurs when an insurance provider determines that the prescribed medication is not essential based on clinical guidelines and available medication evidence. This often happens if a lower cost or formulary alternative is available, and there is no documented evidence showing the prescribed drug is necessary. To overturn the denial, providers may need to submit additional documents such as past treatment failures or specialist recommendations. To address this, the provider should submit an appeal supporting the documentation. This can include medical records, previous treatment failures, recommendations, lab results that could demonstrate why this medication is being prescribed over the alternatives. A non-formulary medication is a drug that is not included on a patient's insurance formulary, meaning it is not covered under their insurance plan by default. This often requires the prescriber to request prior authorization or explore alternatives. Formulary options such as generic or preferred brand name drugs before coverage is approved. To address this, the prescriber can request a formulary exception by submitting prior authorization with medical justification for why the patient needs the non-formulary drug. This may include evidence of previous treatment failures with formulary alternatives or specific patient conditions that make alternatives inappropriate. If denied, the patient can explore appeals, manufacturer assistance programs, or consider switching to the covered alternative. Step therapy requirements are insurance-mandated protocols that require patients to try and fail lower-cost or first-line medications before coverage is approved for more expensive or non-preferred drugs. Insurers implement this process to control cost and ensure patients receive the most cost-effective treatment first. If the prescribed medication does not meet step therapy criteria, prior authorization is required to justify why the patient cannot use the preferred alternatives. To address this, the prescriber can submit a prior authorization request with medical documentation showing why the patient cannot use the first-line treatments. This may include records of past medical failures, adverse reactions, or contraindications. If denied, the prescriber can file an appeal or request for an exception waiver by demonstrating the medical necessity of bypassing step therapy. High-cost medications are drugs that are expensive, often due to being specialty medications, brand-name drugs, or newly developed treatments. Insurers may require justification to ensure the medication is medically necessary before approving coverage. These medications often require prior authorization and may have alternative, lower-cost options that insurance prefers. To obtain approval for higher-cost medication, the provider should submit a prior authorization request with supporting documentation such as medical records, treatment failure, and clinical guidelines demonstrating the necessity of the drug. If denied, the patient or provider can appeal, explore manufacturer assistance programs, or check if the medication is available through alternative coverage options like patient assistance programs or discount programs.
Dosages or quantity limited. These are restrictions set by insurance plans that limit the amount of medication a patient can receive within a specific period. These limits are based on safety guidelines, cost control measures, or FDA-approved dosing recommendations. If a prescription exceeds these limits, the insurer may deny coverage unless additional justification is provided. To address a dosage or quantity limitation denial, the provider can submit a prior authorization request with medication justification for the higher dose or quantity. Supporting documentation like clinical guidelines, past treatment history, or evidence that the standard dose is ineffective may help overturn the denial. If denied, alternatives include appealing the decision, adjusting the prescription to fit within coverage limits, or exploring manufacturer assistance programs. Incorrect billing. This occurs when a prior authorization request is submitted with errors such as sending it to the wrong insurance plan, using incorrect patient or provider information, or billing under the wrong benefit. These mistakes can lead to automatic denials, delaying patient access to medication. To resolve an incorrect billing denial, the pharmacy or provider should verify the patient's insurance details, ensure the correct billing codes and benefit type are used, and resubmit the PA to the appropriate insurance plan or pharmacy benefits manager. If errors persist, contacting the insurer for clarification or using real-time benefit verification tools can help prevent future denials. Coverage restrictions occur when an insurance plan only covers a medication for specific conditions or patient groups based on FDA approvals, clinical guidelines, or cost effectiveness. If a prescribed drug is used for an off-label or non-covered indication, the insurer may deny coverage. To address a coverage restriction denial, the provider can submit a medical exception request or prior authorization with supporting documentation, including clinical studies, guidelines, and patient history, to justify the off-label use. If denied, alternatives include appealing the decision, switching to a covered medication, or exploring patient assistance programs. Here are some ways to navigate a prior authorization. Even when prior authorizations are in place, there's still ways to navigate through this troubling time. Because prior authorizations are first sent to the doctor, the first course of action is to work and communicate with one's provider. This ensures that both the patient and the doctor are both aware of the prior authorization and are on the same page with the next steps. The provider then may switch the course of treatment or continue with the prior authorization paperwork, depending on what they deem necessary. This process can be quite time-consuming and isn't always guaranteed. Another option is to pay out of pocket without insurance coverage, but this can be quite expensive and impractical for many patients. Finally, patients can also refer to discount programs or assistance, which we will dive deeper into the next slide. There are 3 major ways to obtain medications even when prior authorizations are in place. First, discount cards are a popular option that can help reduce the cost of medications. These cards are often provided by drug manufacturers, pharmacy savings programs, or third-party organizations like GoodRx. Patients can present these cards at the pharmacy to potentially lower the out-of-pocket costs for their medication, regardless of insurance coverage. However, it's important to note that these discounts typically cannot be combined with insurance copays. For patients who face denials or delays with their prior authorization, discount cards can be quite quick and cost-effective temporary solution. Next, patient assistance programs, or PAPs, are programs offered by pharmaceutical companies to provide free or discounted medications to patients who qualify. These programs are designed to help uninsured or underinsured patients, and the eligibility criteria typically include income level and lack of alternative coverage. While applying for PAPs can involve paperwork and documentation, many companies offer support services to guide patients through the process. For high-cost medications that require prior authorizations, PAPs can be an excellent long-term solution for those who meet the requirements. Finally, paying out of pocket is another option, though it's often considered a last resort due to the financial burden it can place on patients. For some medications, especially generics, paying out of pocket might actually be cheaper than using insurance or waiting for the prior authorization. Patients should work with their pharmacist to compare costs between using their insurance and cash prices. Additionally, some pharmacies offer low-cost generic programs that make this option more affordable. While not ideal for everyone, this can be a helpful route when time is critical, such as when a patient needs medication immediately.
Many insurance companies outsource their prior authorizations. Some of these outsourced companies, such as Apollo Med and Evicor, these are medical benefit management companies that review the prior authorizations for the insurance companies and Medicaid programs. Companies like Evicor don't care about the patient's medical conditions and focus on retaining profits. What used to be used to make sure services are medically necessary seem to now be focused on making sure the insurance companies will stay in profits. Patients' conditions can worsen, especially for time-sensitive treatments waiting on prior authorization approvals. Delays in accessing medications due to insurance restrictions, prior authorizations, or cost concerns can lead to disease progression, increased hospitalization, and overall poorer health outcomes. Healthcare providers and pharmacists spend a considerable amount of time managing prior authorization requests, detracting from patient care. It often delays patient care. These growing diversions from patient care can serve as one of physicians' biggest source of professional dissatisfaction. And these huge administrative burdens for physician practices that often delay patient care. It also can be bad for business or flow of healthcare facility. Prior authorization delays interfere with healthy, productive workforce. So prior authorizations involve multiple steps, including submission, review, and approval by insurance providers, which can often cause delays of necessary treatments, especially if other documentation is required. A patient can experience a worsened health outcome as delays may exacerbate a patient's condition, especially in some cases of chronic or acute illnesses that require timely intervention. Furthermore, insurance formulary is a selective list of drugs that the insurance may cover, so insurance companies may deny prior authorizations for certain medications in favor of cheaper or formulary preferred alternatives, even if these options are less effective for the patient. Lastly, insurance companies can require step therapy as part of prior authorization. Patients and their doctors must document that they have tried at least the less expensive drugs first, which takes time, especially if the medication has a titration rate of 6 weeks. Titration of a medication means slowly increasing the dose of a medicine by very small amounts over days, weeks, or even months to find the right dose that is effective for you. This allows your doctor to see how your body reacts to the medication without giving you excessive side effects. This slide highlights key strategies to minimize concerns related to prior authorizations, a common hurdle in medication access. It emphasizes the importance of doctors and patients that can aid in streamlining prior authorization systems to reduce delays. On a legislative level, verify insurance requirements upfront to prevent issues and advocate for changes in approval guidelines when necessary. By improving these processes, healthcare providers and pharmacists can enhance efficiency, improve patient communication, and help ensure timely access to essential medications. So, as we discussed, prior authorizations are a huge barrier to patient treatment and medications. The delay in care, treatment abandonment, and further hospitalizations are some of the many ways prior authorizations negatively impact patients. Right now, prior authorizations are on the rise. For example, in Medicare 2025, there is a smaller out-of-pocket cost of $2,000 compared to $8,000 for Medicare 2024. While this may seem good from a distance, we avoid falling into the donut hole in catastrophic coverage. Insurance companies may use prior authorizations to deny treatments and medications for the patients, which would force the patients to spend more money when they have to pay out of pocket because insurance companies won't even cover part of their treatment. In the future, there will be more insurance companies being introduced and more prior authorizations will be requested. As a healthcare provider or a member of the community, what we can do moving forward is become medication experts in the area and pass it along to our coworkers and neighbors. Staying up to date with prior authorizations, step therapy, and incoming insurance policies will not only benefit everyone around us, but may help combat prior authorizations and the denial of our treatment and medications.
This wraps up our podcast. Thank you so much for taking the time to join us. I hope you found it interesting and informative. You can access more of our healthcare podcasts on our website at phbsp.org. Please feel free to reach out to us if you have any questions or concerns about healthcare issues. You can reach us by calling 412-266-8322 or by visiting our website and leaving a message on our Contact Us page. Until next time, stay safe and healthy.